Good afternoon, everyone. My name is Richard Engberg, and I'm an equity research analyst here at Erik Bank. We focus on software and tech. With me, I have Mr. Göran Malmberg, CEO of Mentice. Göran, welcome.
Thank you, Erik. Okay. Thanks for having the opportunity to present Mentice here. So we can start with the slides. Change, please. Disclaimer, we can move. That's me, we can move. Thank you. So first, just the background, what the arena we're working in, obviously, this should be known to most of you, but I think it's a good backdrop for what we do. We obviously working in an environment where there's basically a perfect storm of challenges in healthcare. We see we have a rapidly aging population. The cost of healthcare is expected to probably double in the next 20 to 30 years. We see that there's raising labor costs and staff shortage. It's expected to be a massive shortage of resources over the next 10 to 15 years. And we also see it with the increased complexity of procedures and the new advanced procedures. There's also the geographical challenges also increasing quite rapidly. What we're dealing with here, and what I will talk more about, is we see also the rapid transition from open surgery modalities to minimal invasive kind of treatment modalities, which is what I will talk about. What we all see in the world, the non-communicable diseases like heart diseases, cardiovascular diseases is really what's growing, and obviously it's good that we are removing the communicable diseases, but this is also the major focus that we have. Okay, we can move to next. So the area we deal with, where our solutions are applicable, is the image-guided interventional therapies, we call it IGIT, and it's really everything to do with the blood supply or the blood system, vessel system in the human body, and these treatments are really everything around to improve flow in the environment, to open up blocked vessels, to kind of repair aneurysms or balloons or ruptures of vessels, potentially embolize the vessels, so block the blood supply to a certain organ, but also to treat the organs that are connected to these systems, like the heart. There's a lot of things happening in terms of these treatment modalities where you can actually, through the vessel system, navigate up to the target point, and you can repair a heart valve, place a pacemaker, or so. So the advantages here is that with these procedures, there's really no age limit. Prior, if you do open surgery, you need to have a certain level of physics. Maybe you can take a treatment like that up to 82, 85 years old. These kind of treatments has really no limits of age, and the reason for that is no open wound that leads to much shorter hospital stay, less pain, less need for anesthesia. But it's also a complicated set of procedures, and the development is really rapid. Okay, we can move to the next one. So what we deal with here, and what we do is really looking at this environment where you can see that for every new treatment coming out, we know that any physician, regardless of experience, really need 25, 50, sometimes upwards to 100 procedures experience before that physician can operate in an kind of efficient way. So that obviously causes a major issue. How would you do that? No one wants to be any of the first 50 patients. And this is not just about training or the classical training. It's just not something you learn during your training period. This is a continuous requirement to be on the top of your game and make sure you learn everything new that's coming out. But also if you've been away for a vacation, been away for a couple of months, or you haven't done that procedure for 2 months, then you also need to rehearse and practice. So that's really what we deal with. All right, go to the next, please. So brief background on Mentice. We probably broke 20 million in net sales last year, which was really nice and really proud about that. We are a fairly small but global company. We are present in 12 locations in the world, fairly evenly spread out in the world. We've been around since '99, so we are not a startup in that effect. We're about 120 full-time equivalents. Half of that is in Sweden, in kind of Gothenburg, Sweden. And then we have a fairly large organization in US, and then we have also then staff in Japan, where we have a subsidiary, in China, and we're in India, Singapore, and a couple of other places. So we have a very strong engineering base, technology base, where about half of our organization really work on the product development, product definition. We have a strong underlying technology, well supported by a growing patent portfolio. Again, a small market, fairly small company, but we have more than 50% market share. And I would say in certain areas, maybe also much larger than 50%. All right, can move to the next, please. So the business segments here is really, if you look at the leftmost here, is the healthcare systems for the hospital market in the world, where we currently have about 500 clients in the world. Initially was mainly teaching institute to university hospitals, fairly well spread between the North America's continent, or the Americas continent, Europe and Asia. Example, very strong position in Japan, where we have more than half of the university hospitals as clients. China as well, very strong. China is now our second largest market in the world. So that's a strong base, but that's still a fairly small part of our business. It's about last year only basically 15% of our last year about 20% of our business. Typically should be 30% or so. The middle part here is really our bread and butter. That's the medical device industry in the world. Should be between 60 and 70%. Last year slightly higher, where we really support these large medical device companies in how they bring products out to the market. So that's our main business side. And then I would say the large upside is on the right, where we have collaboration with companies like Siemens and Philips. We'll talk a little bit more about that. Okay, we can move on. Yeah, we can move on more. Yes, thank you. So as I said, we've been around for a while, but what has happened in the last, say, 3 or 4 years, that we have really grown our business in US. We did an acquisition there back in 2017, and we have invested in the organization there. So going back 3 or 4 years, we had about 1/3 in each of the main regions, Americas, EMEA, and APAC. But over the last 2 years, we have more than 50% of our business in US, which is a really good base, since that's the world's largest market for healthcare and for medtech. Yeah, we can move on. So this is really our solution set. So what we are doing is really trying to replicate the human body. So we do that in a different way. So the core of our product, what we initially started with is the leftmost side here, which is a simulation platform with a hardware and software. It's software dominant solution where we really replicate and support over 50 clinical procedures in this space, where we really allow for a doctor to not only train but also to rehearse and plan a specific procedure, where we replicate the human body, we replicate the clinical devices used, and we allow a doctor to run a complete procedure in a very kind of realistic way on a simulator. We added during 2020 another company that do a physical flow system, which is really a complement to what we do, where we provide solutions for conceptual design, product development, but also very advanced procedures where you actually 3D print an anatomy and you run the actual clinical devices under X-ray. So that's a complement to what we do on the kind of virtual reality side. And then adding on what's really been a big development over the last couple of years is the software only and the cloud-based solutions, where we see more and more requirement to do training activities of the web, but also to have an advanced clinical work being done on a software only basis. In terms of our interaction with the device industry, it's a lot around us developing a certain device, mimicking a certain procedures. So that's a very core part of what we do. As you said, we have more than 60 people working on the technology side, and I would say probably 20 to 25 of them work on developing specific solutions for these specific clients. And then on the rightmost side is the integration with these Cath labs, so the treatment room or the X-ray equipment used specifically to provide the imaging for these kind of procedures, is where we have integrated our solutions into that environment. All right. Can move on. Thank you. So this is a business slide. I'm not dwell in too much detail of this, but if we go from the left, we have developed really from a training tool. We go into objectively assess or train to objective assessment in kind of working to proficiency, going to team training basis, and then on the rightmost side where you have the red dot there is really where we are now, where we really do precision medicine related activities, i.e. where you can import a specific patient, a specific anatomy. So if a physician have a procedure that's going to happen maybe next day or two, he or she can import an X-ray or a CT data of that patient. We can import that into our environment, and the doctor can then have an ability to try out different techniques, try different devices, and really rehearse and plan the procedure. And in most cases, he can then perform the procedure on the actual patient and in shorter time, but most importantly, with less risk for a complication. The rightmost side here is the predictive side. It really is our ambition over the next 2, 3 to 5 years, where we really want to move into the physician guidance side, really provide decision support for physicians, really help them both before but also during and after the procedure. All right, we can move. Thank you. So here again, the client, I think we talked about that mainly, but on the left side, you see the hospital side where we have delivered 500 systems or more. And the device industry, where we have probably upwards to kind of 100 clients. We deal with all of the 10 largest medical device companies in the world, companies like Medtronic, Abbott, Boston Scientific, and others, Philips and Siemens. So that's our base business. On the lower part, you see the medical societies, where we listed a couple of them that have selected Mentice solutions for their certification and training of the different societies. You have the GGNR, which is the kind of neurovascular society in Germany, that have standardized on Mentice solutions. You have to the rightmost side the DEGER, which is the IR, the interventional radiology side. You have the SBNR, which is the Brazilian kind of neurovascular kind of society. And then you have EBC, which just currently have enhanced their support for what we do in the kind of cardiovascular side. All right, we can move on. Thank you, and you can click another. Thank you. So this is an example of an integration with Siemens, where you see here one of these treatment rooms, so these Cath labs. So he's a doctor really performing realistically an actual patient's anatomy. So he's rehearsing on a patient he will have later the same day. And this really enables him to prepare himself for the task, to really make sure he's on, as I said, on top of his game when he actually have the actual patient in. This is an amazing ability for physicians to really remove risk from procedures and have that integrated in the actual treatment room with the actual equipment, having the X-ray camera move around as it does in the real life. And so it's really something that we believe very, very strongly in. All right, we can move on. You can click another one. So this is another example. I'm not going to show the entire one. This is a team training example from Sahlgrenska down in Gothenburg. So here you see 3 doctors performing a case on the simulator. And in this case, we will have a vessel kind of rupturing. So you will have blood coming out in the body and inside the heart. So the patient will crash, the heart will stop beating. And in the same time, the emergency team have to come in and start to do go in and do heart compression. And why the doctors need to get the patient's heart to stop beating again. So this is a really, really realistic environment for these doctors to practice. Okay, we can go on. We can actually move on. See, I will have 3 minutes left. We can move to the next one. Click one more. And this is just briefly, it's another example of a big future opportunity. Or this is in the robotic side, where we, in this case, integrate with Corindus, which is a subsidiary of simulation of Siemens, where same thing here. The physician can really run real procedures, have realistic anatomies, and really use the robot in a very efficient environment for them. This is also a large opportunity for us. Okay, move on, please. And this is really the device industry. This is one example of a fairly recent client that started to work with us for sort of a year ago. And they use this for introduction of the device out in the market. It's fairly complicated device where in this case, the doctor down to the left here say that this is really realistic for him. And he will use it before every case to make sure that he's really prepared for the task. All right, move on, please. And this is an example of the physical simulator, how you then 3D print real anatomy, and this is again used for conceptual design and device development, where physicians and device companies really see this as an effective way of really trying out different versions of a device. which is not possible in the virtual environment, but it's really effectively done in this way. All right, move on, please. So just briefly, last couple of slides here. So we'll probably run over 2 minutes or so. We really had a good year last year. We have had a couple of rough years during the pandemic, obviously. But last year, despite the fact that the hospital market has not really restarted, we had a really strong year overall. We did 35% growth year-over-year on the top line. Our industry side in the fourth quarter was growing with basically 22%. Our net sales year-over-year in the fourth quarter were also significantly higher, almost 50% higher. And we did produce an EBITDA margin in the fourth quarter of 24%, if we exclude some one-off items. We also have come into 2022 with a significantly stronger order book. So we have moved up to 87 million, almost 90 million, which is a 29% kind of increase. We also did announce a collaboration with Siemens in China, integration with their robotic arm, the Corindus, where they have confirmed that they will bundle every sale of a Corindus robot with a Mentice system into sales in that market. All right, next please. Yeah, we can move to the next section. So really, as a summary, I mean, we see, I think to some extent driven by the pandemic, a really increased interest for online remote solutions, which we support in a good way. I think our position is really strong with the combination of the both physical simulation and the virtual one. And really we've seen over the last 5-6 years that the investment we have made and the market share we have gained, we have really very few competitors left. I mean, 5 years ago we had maybe 2 or so competitors that was on similar level, but Mentice is now significantly larger than the nearest kind of competitor. We also see that the robotic side and the imaging side is a very large opportunity for us. All right, can go to the next one. We skip that, go to the next one. So really what we do here is we work around the idea of the vascular twin. What we do generally is to build a replica of the human body, and we use that replica then to provide solutions for training, for decision support, for planning, but also for conceptual design and device design. This is really where we want to expand. This is where we see our future to really be the leading provider into this field, and we go deep down in the therapy area that we deal with. All right, next please. So this is the last slide. So really, we believe we have a really good position. We had a really strong year, mainly on the medical device side. We can see that we are more than double the size of our nearest competitor. We all see that we spend and invest way more on development than anyone else do, which also gives us confidence for the future. We're pretty pleased with the 2021 outcome with 35% increase on top line. But we can also see that we have over the last, say, 5 years, doubled our size. Over the last 10 years, more than triple our size. We believe that the imaging side or robotic side is a fantastic opportunity going forward. And obviously, the hospital market during the COVID period has been difficult. So we're not really working on all fronts, but we hope that the hospital market will open up now in 2022, and that will hopefully help us in both for 2022 and 2023. So really our ambition is to be a critical part of the performance in the clinical practice and really provide solutions, as I said before, during and after a procedure. All right. I think I'm done.
So thank you, Göran. And I'll prepare some questions for you now.
Sure.
And my first question is, can you please describe the Chinese market for cath labs and robotic surgery now when you have your bundling agreement with Siemens?
Yeah, you know, China is a really interesting market. That's not a very bold statement, but there's about 2020 there was about 35,000 hospitals in China, which is pretty amazing, but also they are building more than 1,000 new hospitals every year in China, even more. So if you look at the market, I just looked at the Siemens annual report this morning, and they have the 24% increase in this Chinese market, up to 2.4 billion euro. I think it's only US as a single market that's still larger, but the growth in China is pretty much double compared to any other market. So this is clearly a market where all of the big medical device companies, imaging companies are focusing, and the number of system moved out in that market every year is pretty amazing. I fortunately don't have any details what it mean in terms of actual numbers for us, but I mean I think that's clear that in the next couple of years that market is going to be growing significantly. We can see from other parts of the world that it's probably not unlikely to believe that 10 to 30% of the systems sold, the X-ray systems sold, going to be equipped together with a robot. So that could be some kind of indications, but this is clearly a big step forward, and we're obviously working hard to come to similar agreements in the rest of the world.
Good. And looking at the hospital market, can you please describe how you prepared this segment for an eventual reopening of the industry and the economy?
Yeah, you know, it's a good question. I mean, I mean, we have discussed this a lot in our board, of course, and we have really continued. We have not pulled any resources away from the hospital market during the pandemic. We continue the same sales force and the same support, and we have not pulled resources away from that. So we really pushed hard during both 2020 and 2021, and we continue building our pipeline, and we have not really stopped working. So I think we are prepared for that, and we see that I mean the big thing we saw in 2021 as the conversion of opportunities was extremely low. I mean less than a third that we normally have. So we can get conversion rate of opportunities back to normal levels. We should come back to the levels of 2018, 2019. But to your point, I mean we still 2021 was less than half for hospital sales compared to 2019. So we clearly have a large upside there.
Okay, good. Then can you please describe how your recurring revenues would develop now when you have a bundling deal with Siemens?
Yeah, I think I mean everything we do via the imaging partners, Siemens and Philips, but also directly to the hospital market. But I would say also more and more with medical device. Medical device is more and more OPEX related. More and more of the systems there are actually rented. That the general, if you look at our report, Q4 report, you can see that we have a larger growth on the software side and the recurring side than we had on the system side. So I have a hope that we can continue to grow the software component and continue to grow the recurring component. And we're also pushing. You made some statement of that, Richard, in your reports, but we are moving more and more revenue going forward. You see the order book is moving up quite significantly, and that's obviously, you can say that's impacting us short term in the actual year because we're pushing revenue ahead of us. But that's the plan. That's what we want to see. And our hope is that in a couple of years we'll have a much larger portion of our business done when we come into a new year. So all of that is positive development, and I think is exactly what we want to see.
And good. And my last question would be, given your high gross margins, one of the highest in the medtech industry on the Stockholm Stock Exchange, what is the key driver to expand your profitability margins going forward?
I think one of the benefits we have is that we have one hardware platform. Everything we do based on the same hardware. That's pretty unique. I mean, many other companies in this field have 3, 4, 5, 6 different platforms. So we can work everything off one, and we have done 4 or 5 generations of that hardware now, and we are obviously trying to optimize that for every step. So I think we can work on reducing the cost of hardware, make that more efficient generally. But I think the biggest development here is really to move more and more into the software side, provide more solutions which is software only, and really move the company more into the software. I mean, we are, I would say 85% of our engineering resources, probably even more, are software oriented. And so we are not really that hardware dependent, which might be the case for many other companies. But I think we can increase the software component. We can still continue to improve the proficiency of the hardware side. So I mean, I'm not planning for any dramatic improvement on gross margin, as you say. I think we are pretty pleased with what we have, but I think we can, in the next couple of years, we can expect that we can continue to build on the margin. Yeah.
Okay, good. Göran, thank you for taking your time participating here at Erik Penser Bank, and
Always
thank you,
pleasure.
and thank you everyone for listening. That was all for me.